Next up, we've got HealthTap, and representing the company is Michael Nichols, the Chief Privacy Officer and General Counsel. And really what they're doing is trying to remove some of the frictions in our capture of the information. So take it away.
He's got me all wired.
Are the most fundamental interaction in health. It starts when we're young with a parent and a child. In adolescence and early adulthood, the question and answer often takes place between us and a family practitioner. Later in life, we turn to specialists for our questions and answers. And that's the traditional way that health questions are answered. But the traditional way that health questions are answered isn't really the way that health questions are being answered today. Today, the question and the answer paradigm are shifting, and they're shifting oftentimes away from the doctor. When a question and answer paradigm shifts to going online and looking for information, we often rely on information that's not necessarily from a trusted source. We don't know whether it's current, we don't know whether it's relevant, and oftentimes it doesn't actually answer our question at all. We might read an article or participate on a forum, but knowing that we have a real answer from a real doctor isn't really the way that many people are getting health information today. And that's a problem. And the cost of that problem is high. The problem is that when we look for health information online, most times what we find is not helpful. Google searches 1.2 billion health searches a month, and 80% of adults who participate online search for health information. But 48% of them report that the information that they find isn't helpful. So what do we do about that? How do we solve that problem? We solve that problem by bringing doctors online to answer people's questions for real. We virtualize the question and the answer, the most fundamental interaction in health. And that's what we've done at HealthTap. The result is that when people can ask their questions to real doctors online, they get trusted information, they get actual answers to their questions, and they get an understanding for what the consensus of the medical community is. Because in the real world, even when you ask questions and answers, you face an issue, and that is that the transaction is siloed. It's one person to another behind a closed door. And people don't always understand what other doctors might think of those answers. When you virtualize the question and answer process, and you take it from a one-on-one interaction and you make it a one-on-many interaction, what you do is you give people insight into the collective knowledge of the medical community. And that is revolutionary. So here's how we've done this at HealthTap. We provided a forum for people to ask questions to doctors. We have over 10,000 US licensed physicians who participate in our medical expert network, and they're answering questions every day for free. Real answers and real questions from real doctors that are a trusted source of information. So we'll start by showing you a demonstration of how HealthTap works. If a user logs on to HealthTap and asks a question, for example, what can I do to stop migraine headaches? Even without being logged in, as you can see here, the user sees all the questions that have been asked and answered already on HealthTap. And this is something that we do that's fundamental. We show people all of the information that's contained within the system. So they can see that there are questions very similar to theirs that have been asked and answered. And if they want to read one of these questions, they can sign up through a simple process. Now here, what we're going to do is we're going to show you a HealthTap question and answer for a user who's signed in. So this user has created an account. And they log in. And when they log in to their account, they are able to track information on HealthTap. So in addition to being able to ask questions and receive answers, they actually have an activity feed and other robust features that show them when new information about topics that they care about comes online. So here, the user is going to ask a different question to the system. And that question is, what's the difference between a cold and a flu? Now, The user asks this question, and they can, by tapping it, send the question out to the network of 10,000 physicians. What we do on our end is we triage that question to specialists so that when people ask questions, they're not just getting a question answered by a doctor, they're getting a question answered by a qualified physician. Here, rather than asking the question or sending it out to the network of physicians, we see that this exact question, as well as similar questions, have already been asked and answered. So when you click on the answer to the question, the user is able to see what the answers are. Now, what we also allow users to do is see that their question has been answered by more than one physician. And this gets to building the consensus in the medical community. Here you can see that 2 physicians have answered this particular question with a short answer and then a more detailed answer. Users, when they like these questions, when they like the answers to the questions, can thank the doctor for their participation, and they can see where there's a difference of opinion inside the medical community. They can also see comments that have been provided by other physicians. Now, when you see an answer on HealthTap, the other thing that's significant is that you actually see the real physician who's provided the answer. It's not just, again, an answer from a doctor, and not just, again, an answer from a qualified doctor, but an answer from a specific physician who participates on the system under their real name with all their real information. Now, users can also see when other doctors have agreed with the answers that appear before them. And what this means is that users understand not just what one doctor thinks of an answer or a different doctor who's answered the question, but they're actually able to determine what the medical community thinks about the quality of the answers that they're using. And this allows us to incorporate data into the question and answer process so that users can actually assess the consensus or the plurality of opinions within the medical community. Here, when you look and see doctors who agree, HealthTap shows you all of the specific physicians who have agreed with a particular answer. So everything in HealthTap is built around transparency. And this is why the system that we're building, we believe, will convince users to come on board and doctors to participate, because it relies on 3 variables: trust, transparency, and merit. Trust is accomplished by qualifying all the physicians who participate on HealthTap and allowing only currently US licensed physicians to participate. They have to be in good standing, and they have to apply to participate in the network, which now has over 10,000 doctors in it. In transparency, what we do is we show you and tell you everything about those physicians. So if you were to look at Dr. Albert Pizzo, you would be able to see, for example, where he participates, his address for his practice in the real world, information about his medical education, his awards that he's received, his publications, and other information that you could use to go visit him in the real world. You also see a repository of that physician's answers that they have provided on HealthTap. So everything that they do is available through what we refer to as a virtual practice. And by creating a virtual practice for physicians that has all of their content in it, users know that there's complete transparency, and there's also accountability on the part of the physician. So now that we have a system where every doctor is trusted and the information is high quality, and we have a system where doctors are participating under their real identities and under their real names with their real contact in the real world, and a system where answers are transparent because we see exactly who's answered the question, and also all of the questions that that physician has answered, and also every physician who has agreed with that answer, we have insight into the medical community's assessment of the information that we're reading, and that creates trust on the part of the user. Now, another element that's required to create trust on the part of the user is something that we don't have for the doctors, and that's doctors have to participate with their real names and their real identities and their real contact information. Users can participate anonymously, and we call this secure sharing. So when a user asks a question, that question appears only under a user's public profile name, which they create when they sign up. By allowing users to create anonymous identities to participate socially in health, what we're doing is we're opening up the universe of question and answers and a social sphere to the trust of the user that they can ask any question that they really want. And this also goes back to data, because we can see when people are asking questions from specific geographic regions, and we can get information about trending questions and trending issues. And while there are other services that provide you with insights into this as well, the main difference is that health can be sensitive and health can be embarrassing. And we're not always all going to be interested in tweeting or Facebooking or sharing information about our health on other social networks. Which brings me to the final component of the social network that HealthTap has created in health, which is merit. Trust, transparency, and merit. By allowing users to thank doctors for their answers, we have an assessment or an understanding when an answer is useful and when the user community agrees that it's so. By allowing other physicians to agree with those answers, we also see when they have weight within the medical community. This weight within the medical community is one component of what we refer to as a doc score. A doc score is significant because it allows us to rate and rank the answers that users see in ways that you can't get elsewhere. We actually allow users to see the answers that are determined to be the most trusted by the medical community, the most thanked by the user community, and that also come from the doctors who have the highest doc scores. And doc score is based on a number of variables that allows us to assess and determine the quality of the answers that the doctors are likely to receive. So let's go back home and continue with the demo and ask another question. And the other question that I want to ask is also related to the flu. Can the flu shot give my baby the flu? So when we ask this question, what we see again is the plurality of opinions among the medical community, and we'll see that some of these answers are ranked more highly than others. Here you've got two answers that have 4 doctors agrees, but you also have another several additional answers. One of the answers here is undefined, which suggests that the question may not have enough information. But here you can see that multiple doctors agree with answers, but they all have the same fundamental answer, which is no, this is fine. The answer that's ranked most highly is the one that comes from a doctor with the highest trust score, and also the answer that the users find most useful and that other doctors believe is the best way of explaining this information to users. The data on our system comes in the background for the ontology, which is a robust system that allows us to direct questions to the right users and also allows us to promote related questions that have already been asked and answered. So underneath every question, you'll see that there are a list of similar questions that have been asked and answered already that other people who had viewed this question were also interested in. We allow people to search via keyword on HealthTap, and that keyword is built into our ontology. And that gives us data on the back end about what people are asking in particular areas, which has public health implications and allows us to contribute fundamentally to building a data set around public information for what users are asking in health. So with trust, transparency, and merit, and by allowing people to engage in the most fundamental interaction in health with real doctors, where they can get real answers to their real health questions, HealthTap has created a social network for physicians and for health information and for consumers that we hope will bring virtualization to an interaction that's happening now online without doctors, but with HealthTap can help happen with it. Thank you. Yes. Well, I think fundamentally doctors want to help, and they want to be, okay, the question was, how do you get doctors to give straight answers and not hedge the answers that they provide? And I think fundamentally it's because doctors want to be helpful to users. But what we're doing here at HealthTap is we're allowing people to access quality health information, which is really answers to health questions that are for informational purposes. So you can give a very specific informational answer to a very specific question. And there are lots of questions on HealthTap and lots of different answers. So there really is, I think, room for being direct in the answer to the question within the context of providing quality health information and being outside of the context of actually providing care.
Had a question on your market and your financial model. Are you mainly interested in the individual market, or you might also sell this to health plans? And then do you have to pay your doctors, or is it through advertising, or how are you managing to finance this?
Great question. We're managing to finance it through very gracious investors. Really, they've allowed us to do what we do best, which is first to build product rather than to build a financial model and then trying to get a product to fit it. So HealthTap is a free service. It's free for physicians and it's free for patients to participate in, and it allows people the opportunity to really ask questions and get answers in a straight fashion. There will be a financial model going forward in the future, but at present what we have is we have a free system for doctors and users, and the doctors are not compensated. What they receive for participating on HealthTap is they receive the ability to attract local patients and to develop for themselves a reputation online that's assessed by their peers and has real significance and real meaning within the medical community, but also to users. Thank you.